together.
Sorry, can you see?
Yeah. So what can you see initially?
That side's built up more than that side.
Yeah. Right footed or left footed, sir? Right footed. So he's telling you he's right footed.
So it's built up the right side more.
Why does one leg look longer than others?
Yeah, quad.
Yeah, one leg is slightly. There is a slight leg, very, very slight leg discrepancy.
The right knee pushes in a bit more than the left side. Oh, I can't help it. I'm critical.
No, but it's right. It's you're going in the right lines. Right, being a good detective.
Muscle bolt on the right.
Yeah. So it's built up a lot more.
Yeah, built up a lot more.
Are you a striker?
No, centre midfielder.
But he's right-footed.
That leg looks like it's obviously like a lot more dominant.
Yeah.
Yeah,
all the way along.
Yeah. You know. So then if
that one.
Yeah.
That one there.
Why don't you think like this side is bigger?
No.
So if you do,
Because of the way
is bigger.
this is built here, then that.
You can
For the-
see all the knee.
yeah. If I do valgus and varus, where there's a little bit of play there, a tiny bit of play, not massive, but tiny. And then if I do there,
It's more to that side.
it's more to that side. Yeah.
Did that hurt?
No.
Which side you felt gave a little bit more laxity?
Probably the inside.
Yeah. Yeah. So the inside, when I done the inside, it felt more lax there than that side.
Yeah.
All right. Again, so if he's telling you that, and if you look at the position of the feet, look at the feet as well, the way that the feet is.
One's straight and one's turning
Yeah.
out. Or straighter.
Yeah. So
Which
1
one's more-
foot.
This one's more
Yeah.
Yeah, that one's more turned out. And this one's got more of a rise.
Yeah. So if you come to where I'm standing, then.
Or stand this side.
Yeah. Come to where I'm standing. Stand where Naz is, and have a look.
I would say that they're kind of more. They kind of look the same to me.
They're not. I'm telling you, this leg
This part of the foot.
is longer than the other.
No, as
Start.
in turning out.
And then, but if you stand here, this
one.
side turns out more
A bit
that
more.
side.
But
yeah.
just slightly though, no?
No. If
look,
you
if you
stand
look at
here,
If you stand on this side,
if you stand this side from
can
here, you
see-
can see
Oh,
it.
better.
Yeah.
Sorry, guys.
So if you stand here, or even at the end of the bed, can you see it?
Oh yeah,
that comes out, and that one's a little bit more
Because it's like
straight.
turned in. His foot's turned in
Yeah.
a bit. Yeah.
And if you're not sure, and you're having a look and you're not sure, try and put the knees together and try and do that. And now relax. You relax. You just relax. Relax your feet and do that.
Yeah.
Yeah. Once you put them together like that and then let them go,
One's at 12, one's at 1.
one's at 12, one's at 1. And you can see that one's definitely leaning out a little bit more. Definitely. There's no question.
You can see that into the knee and all there.
Yeah.
I mean, that looks a little bit more shut, like, yeah.
What about getting them to turn it inward?
Not necessarily turn inward. Let them fall as they lay, because when you're laying in that position, your brain tries to get your toes to be at 12 o'clock naturally. If your toes don't naturally fall at 12, then there's something happening to cause that lateral medial misalignment.
Just realised one says right and one says left. I was like, oh. Sorry, it's the little things.
It's like they're on the right one.
Yeah.
So are we all agreed that this is the leg that has got the problem?
Yes.
Yeah. You're allowed to say to say true or false.
The problem currently.
No, not the full problem, but are we correct that it's this leg?
That you've got issues with.
Yeah.
So can I ask you something? Is the reason this leg is a bit shorter than this leg is because the muscles in this leg are hella tight? Is that a reason?
That's one of the reasons, yeah.
Could it be? Sorry. Could it be if he's injured this, then the muscle is damaged,
Yeah.
hasn't repaired properly, it's become shorter?
Man's like.
But you were right. You're right.
But then that can make the whole leg shorter.
That can make the whole leg shorter, yeah. So
you
again,
actually get
let me do ACL.
It causes a limp as well, yeah.
Yeah. So the ACL, there's
don't
not
move.
that much
No.
play in the ACL. Yeah. So I think we could rule out ACL.
Not much. To do.
No.
Not much play in the PCL, so we can rule out ACL, we can rule out PCL, but we know it's this leg. Yeah? right? If we was to do that,
Are your glutes weak? That's probably what the problem is.
Yeah.
Your glutes are weak. You don't do no hip thrust now? No squats?
he's a footballer, man. Can't you see Ipswich Town?
But some guys don't like doing hip thrust because they say
Yeah,
it's
that's
too
what I'm
girly.
saying. That's what I'm saying. Them I don't know about them.
What if it's more of a misalignment of the hips from where he's
Yeah.
used
Yeah.
to kicking the ball on one
Yeah.
side
Yeah.
and
But
pushing
then wouldn't
forward?
that leg be longer though? That would be because that's the
No,
striking
because
force.
that
we're
would
doing
be
that.
that would be the contracting
Yeah.
when it
So it
goes
would
to
be
strike.
tighter.
So it'd be tighter
So that
because
shows
he's
that
using
his
that
left
leg.
hip is tight.
So let's do both process of elimination.
Worse on this side, yeah.
Yeah.
Yeah. Yeah.
Worse
his
one,
hand-
isn't it?
Wait. His hand is in the
Oh,
way.
sorry.
Yeah.
Yeah. So would you say that's tighter?
No.
That side's
Yeah,
tighter. Yeah. So he's telling
this
me
side,
this side is
Yeah,
tighter.
yeah.
Yeah. All right. Okay. So now we now know that this side is tighter. So we know hips
That's from the
tighter.
test you can see it's that side.
Yeah. Yeah. So we've done the test. We know that this hip is tighter. The cruciate ligament test is not coming up with anything, but we know that visually there's some postural misalignment. Yeah. So let's go down to the foot. Let's see what we got with the foot. Yeah. I'm gonna put my toes there. I'm gonna put my 2 fingers there, and I'm gonna go there, there. Anything? No.
Do that again.
There's contraction here.
Yeah, there's definitely the contraction there. Oh, did you hear that click?
Yeah.
You hear that click? So there's a click in between there somewhere. Yeah. The navicular. Yeah. Then if I go, sorry. Anything there?
No.
So if we do like ankle distraction, so if I hold slightly above there and I hold at that part of the foot, and then if I do that, I'm looking to see if there's any play in the ligament, where the ligament is giving me a little bit of play when we're testing for the lower foot. Yeah? Would you say there's a little bit of looseness, a little bit of laxity in there? Or not?
Yeah?
Yeah?
Yeah, a little bit. Yeah.
So there's a little bit of laxity. So he's acknowledging. So we now know that the problem now is now working its way down towards the foot region. We know that there's some laxity in there. Yeah? Okay.
Are you holding his foot down onto the bed while you do that?
So I'm holding this part, and then I'm holding this part of the foot there,